future risk of getting endometrial cancer in case of PCOS.
Hello everyone, in today's video we'll be discussing about PCOS, its recommended diet and suitable exercises for it. So let's get started.
Clinically, if we see, there are different variations in the picture of PCOS. Some people usually classify them as lean PCOS, obese PCOS. Yeah, obviously some people who are lean but have ultrasound investigations showing polycystic ovaries, they are come under lean PCOS. And obese PCOS are traditionally the persons who are experiencing PCOS, weight gain, obesity, diabetes mellitus, and all these things come under obese PCOS. Apart from this, clinically we have different types. Like some people have PCOS on ultrasound investigation, but they don't have features of hirsutism, while some ladies have features of hirsutism but they have regular periods despite having mild PCOS. So there are various types of variations, and treatment also differs according to the symptoms they exhibit. To the treatment, the conventional treatment for PCOS is depending upon the symptomatology they exhibit. There is no one size fits all for PCOS treatment. Depending upon the symptoms, the treatment varies. So if a person is exhibiting hyperandrogenism, like more of male hormones, then the anti-androgens will be given to them. But if a female is expecting a pregnancy, then ovulatory medicines are being given to them, and further they are advised to conceive, to plan conception. If pregnancy is not being planned, then the treatment plan will differ for them by giving oral contraceptive pills. Of course, it will be regulating the cycle, but internally for PCOS to normalize, you need to work on your diet and lifestyle more than just relying on the drugs.
So homeopathy offers solution to PCOS by giving symptomatic treatment. Like, let's say if the female is having absence of menses, or the female may have heavy bleeding during menses. And apart from this, the medicines aim at like acting upon the ovarian cyst rather than giving hormonal pills. Looking into the diet, things which are avoided for PCOS are similar to those that are in diabetes mellitus, because both are interconnected. So say a big no to sugar in any forms, which can be in fresh fruit juices or packaged fruit juices or in sodas, and avoid refined carbs as in bread, pastries, donuts, and all these things.
You can switch to other sugar alternatives like maple syrup, jaggery, brown sugar, and all these things. And second is use more of complex carbs rich in fiber. Looking into the complications of PCOS, it is quite common for PCOS to have obesity, because everything goes hand in hand. PCOS, obesity, diabetes mellitus, and thyroid, all these are interconnected. So there are high risk of getting obesity in first place in case of PCOS. Then type 2 diabetes mellitus, it can either occur as a comorbid condition along with PCOS, or it can occur in near futures. There is a high risk of getting type 2 diabetes mellitus. Next is infertility. So PCOS is prime cause of infertility in the current scenario. And next comes the endometrial cancer. So there is a future risk of getting endometrial cancer in case of PCOS. So exercise is always a must in PCOS. Daily 30 to 40 minutes of exercise is necessary for optimal body functioning. If you are a young female, then you can do cardio, you can do jogging, you can do high intensity workouts. But if you are an aging female, then you have to choose milder exercises. You can switch to yoga as well, and flexibility exercises, stretching exercises, and all these things. And if you are not finding this compatible for you, you can go for walking. Brisk walking is much appreciated. With this, we have come to the end of video. Hope this has simplified PCOS and made it more clear. Thank you for being with me. Stay tuned. Bye bye.